Hey, it's Tuesday, January 20th. I didn't have any ECT today, but I'm having some side effects. I haven't had any ECT in like 3 or 4 days, and I got some shit going on I'm not particularly crazy about. Um, I got the first is I seem to be, I had they call it Parkinsonism. It has nothing to do with Parkinson's disease at all, but what it has to do is a lot of trembling and a lot of shaking, trembling, muscles getting tight. Anyway, I I told you before that I had thrown a bowl of cereal across the room. Um, I had the same thing today. I dropped a glass today, and I've been actually at this point I'm kind of afraid to even pick anything up. Um, I have my I have my appointment tomorrow, so that I can talk to the doctors again, um, and hopefully they can give me something that'll just stop this like constant muscular motion. Um, my belly is killing me because it just keeps clenching and unclenching, clenching and unclenching. Now it gets tiring. It gets painful after a while. And what I really could use is a muscle relaxant to take care of that. The trouble is the only muscle relaxant I have in the house is alcohol, and it's going to make my stomach feel worse. So at the moment, I'm out, fresh out of ideas. I got to find something to do for that. I've also, I think I mentioned also that I'm getting a little manic. I don't know if it's anything to worry about or not, because actually getting rid of the mania is what I'm supposedly doing this for. Is to because the only other drug I know that gets rid of mania is lithium, and I've already explained that I have to stop lithium because of the damage it's doing to my kidneys. Um, I I'd forgotten how used to being normal I've been. I haven't really been manic in quite a while, um, and so the fact that it's coming back is a little disappointing. Um, and the fact that it's coming back as a side effect of the ECT is even more disappointing because I'm still taking as much lithium as I used to. I haven't gone off that yet. We haven't got a plan for it to take me off that yet. And so not only is the ECT causing me to um, become more manic, uh, the drugs that I was taking so that I wouldn't be manic um, don't work anymore, is what it looks like. This is just a halfway point. I'm told that if this happens halfway, don't worry about it. You have to kind of go through it, and that may all be possible. But if for some reason I can't go through it and I wind up stuck, um, I want to make sure I got it on record that I said that I've been manic. It's been like a week now, um, and it's getting worse, not better. I mean, I was hoping it was just gonna come and it would pass, and it's not. Um, so so I got to go through that, and I would tell anyone with type one bipolarism, I would say watch what you if you ever try this, just kind of keep tabs on your mood and so forth. I've seen actually over considering the amount of time that I've ramped up, it's been pretty quick. And I haven't been in this state and wow, I don't even know how long. I would say maybe 3 years, or or maybe I certainly haven't felt this comfortable, this uncomfortable, and by that I mean manic, because mania is fun when it starts, but I don't get that anymore. I just get friggin' like someone's pulling me up on the back of a truck or something like that, and I'm just kind of riding along, getting kind of beat up on the way. Um, and it's also not really a whole lot of fun for people I live with and people I know, and it's just because I'm not really nice to them. Uh, and and I make an effort to be nice, but when I can tell I'm getting stuck. Um, so I'm going to try to keep it together, and I do have a few more tricks up my sleeve to do that with. Um, However, please keep in mind that it's more difficult now, and it's more difficult. I really think it's more difficult, and that's directly due to the ECT. I believe that right now. Um, I may change my mind after tomorrow's ECT. I'm right in the middle. I've got 7 more to go or something like that. I don't remember. Um, let's see, I've had 5. We're gonna go. Yeah, okay. So I've got after tomorrow. I'll still have 6 more to go. I'll have done 6 now. I'll have 6 more to go, and they told me that right about number 8 is where I should start feeling better. So if I start feeling better around number 8, everything's cool. If I don't start feeling better around number 8, I'm probably going to bail out before the whole thing is over with. Also, I keep running across information about the fact that lithium doesn't um, beat up your kidneys, and that's a fallacy, and that's something that I guess nephrologists with nothing to do make that up so that they have something to say to their bipolar patients. Um, I I don't know what to think about that yet. I'm as you can see me ticking even on the screen. I can't even keep the top half of my body steady. Um, so anyway, we're gonna call it a day here. I just want to put this out there because it seems like a significant turn of events, and I want to make sure that anyone keeping up on this, and I know there aren't that many of you, there's just a few, mostly family and stuff. Um, I still thought I would keep you guys posted on what's going on because it's been like 4 or 5 days. It's been since Friday, however long that's been, which I think is either 4 or 5 days. Yeah, 4 days. Okay. Um, they, that you'll at least know what's going on, because 4 days with or without ECT is a long time. Uh, there a lot can go on, a lot has gone on, and so now you know what's going on, and I'll keep you posted after my shock treatment tomorrow. I will come up and do another one, after I take a nap or whatever I gotta do, or wash the goo out of my hair. Um, okay, so that's about it. We're big question mark right now, and hopefully some of that will start to clear up, especially maybe as we finish out next week. We'll be able to tell what direction things are going in. I'm thinking what tomorrow is 6, and then 7 on Friday, 8 will be on Monday. So maybe by Monday or Tuesday next week, I should have a better sense of what direction this is going to take. Um, and I'm gonna try to stick it out as long as possible, not to prove anything to anybody, but just simply um, to make sure I've given it a fair shot. I've had to do the same thing with plenty of meds. I've had to stay on them and make sure that um, you give them a fair shot before you quit them, because then once you quit them, you never go back to them. And then if it was actually one that would have worked if you had just given it another chance. All this is like weird brain stuff, and it takes it just, the longer you use it, the more the effect changes, and it, sometimes things really do change completely after 3 or 4 weeks. Um, Whereas if you judge something in the first couple of weeks, uh, you you're not getting the right read on the treatment. You're not getting a full appreciation for what it can do for you, and at the same time, um, you're not getting the full effect, and you find out whether it is going to be worse or better until. And I don't know why that is, to tell you the truth, but I guess especially it makes more sense for drugs because, you've got to build up so much in your system for it to have an effect. But I don't know why it has to be that way for electricity. I'm not building up a charge in my head. But that's what they ask. They are the doctors. I will give them the benefit of the doubt until they fuck me. And I think we're coming up on a time now where I'm going to be able to make my own decision on it pretty soon. So, in which case you'll, excuse me, you'll obviously hear from you if I make any changes to it, or if the doctors make any changes. I have to have a long talk with them tomorrow before they stick the electrodes on my head. And until then, I will see you.